In this video, I'm going to show you how to create a DAP note in ICANotes Plus. The first thing you're going to want to do is come to the right side of your screen and create some custom headers for data assessment and plan. To do this, you're going to click on Create Therapy Note button. You will give your button a name. And then this is what's going to pop up when you click on the button. So we're going to type data, we're going to bold it, and then I'm going to bring my cursor down below. And then I would click Save. Here you'll see that button here. Now if you need to make any edits to that, you would come up here into edit mode and turn this on. And you'll see here that you would be able to go in and edit that button. You can also create other buttons. These I have hit the trash can on, so they no longer show. But if I wanted to use it again, then I would simply click this recycle button and it would show back up on my column. So I'm going to turn edit mode off. And we will begin writing our notes. So I'm going to start with my data button. We're going to come into client has symptoms of, and you'll notice that it has an automatic header here that pops up. So I'm just going to delete that. And you'll see that options have popped up in this column. And as I click on one of the buttons, you'll see some additional options pop up. Here's some of the symptoms that he is having is sadness, but it is getting better. He's having sleep problems, they're still the same. And then here under adjustment disorder, there has been some loss of pleasure, but it is getting better. We're going to move to the mental status exam. And then here under appearance, he is flat, casually groomed and relaxed. Speech and language were both normal. Mood depressed, it was mild. Through his thought contact, slowed speech and thought, and his body posture and attitude. His affect was normal, associations normal, not psychotic. Has ideas about suicidality but no intent. Cognition was not tested, his insight fair, judgment fair, and had no signs of anxiety. And then we'll move into his rating scale. So we did do a PHQ-9 and he scored a 10. And then we'll move into his behavior. So for medication was regular, self-care is normal, and functioning at work is normal, and with sleep, he's having problems falling asleep. Under verbal content, he talked about problems involving friends and problems with depression and self-defeating behavior. Now we're going to use our assessment header and we'll move into therapy interventions. So our session goal was expression of feelings and self-esteem. Our interventions, we talked about sources of feelings, and we also talked about self-esteem enhancement, and we counseled him on the risks and benefits of treatment. Under suicide violence risk assessment, current risk factors are rapid mood shifts, protective factors, beloved pets. Our suicide risk assessment is that he has ideas but no intent, so his risk is low. Now under our instructions and recommendations, I created some custom buttons over here that I use across the board with all of my patients. So here we want to continue medication, and we talked about the safety plan. Now we'll move into part 2 of our note. We will enter our service code. We want to follow up in a month. And we will now compile and preview. And this is how you create a complete DAP note in ICANotes Plus.